Welcome back to Stop Falling, Start Living, and happy holidays all. Today we are talking about something that doesn't get enough attention: how your blood sugars can affect balance, safety, and the risks of falls. Many falls are linked to diabetes are preventable, and understanding blood sugar is a key part of staying safe and independent. Don't forget, if you like and subscribe to the channel, and tell your family and friends about our channel as well.
Watch diabetes videos at clearlyhealth.com.
A common complication caused by prolonged high blood glucose levels is nerve damage, known as diabetic neuropathy. Nerves are found throughout your body. They are responsible for everything you feel, from warmth and cold to pain. They also play a vital role in controlling your heart rate, digestive system, bladder control, and sexual function. Small blood vessels provide nerves with nutrients and oxygen required to survive and function. Your nerves are extremely sensitive to any change in their oxygen and nutrient supply. Damage to these small blood vessels occurs when blood, containing high levels of glucose, travels through them on its way to feed your nerves. When the small blood vessels are damaged, a sufficient supply of nutrients and oxygen no longer reaches the nerve, causing the nerve to become damaged and eventually die. The first sign of nerve damage occurs in the feet. It might feel like numbness, tingling, or burning. If left untreated, it can lead to complete loss of feeling and spread to other parts of the body. The area of the body most often affected by nerve damage is the feet. Small injuries such as a blister can be undetected due to loss of feeling. Left untreated, these injuries can become infected and, in severe cases, require amputation. To prevent injuries from progressing, it is important to conduct regular foot exams. This will not require much time and will help injuries from becoming serious.
For our full library of healthcare videos, go to clearlyhealth.com.
Hi, I'm your glucometer, and I'm here to give you information about hypoglycemia. What is hypoglycemia? Hypoglycemia means low blood sugar. Your sugar can go low due to illness, certain medications, insulin, exercise, or skipping meals. Hypoglycemia is when your blood sugar drops below 70 milligrams per deciliter. You might be wondering, what is the typical range for people with diabetes? When fasting, which is 8 hours with no food or drink except water, the goal for your blood sugar is between 80 and 130. 2 hours after eating, the goal is less than 180. How do you know if you have low blood sugar? Finger sticks are the most reliable way to know where your blood sugar level is. Sometimes you might feel mild to moderate symptoms: sweaty, pale, shaky, dizzy or lightheaded, confused or disoriented, blurred vision, a fast or irregular heartbeat, vivid dreams, nightmares, or sudden awakenings. Sometimes you might have severe symptoms, like being unable to eat or drink, having seizures, convulsions, or jerky movements, or falling unconscious. And sometimes you might experience hypoglycemic unawareness, which means that your body doesn't give any warning signs that your blood sugar is getting low. This can put you at risk of severe, sometimes life-threatening, low blood sugar. Our bodies don't always give us consistent messages, so we can't depend upon experiencing symptoms to let us know that something is wrong. The only way to truly know if you have low blood sugar is to check with an FDA-approved glucose meter. How do you prevent hypoglycemia? Here are several tips. Eat meals and snacks on a regular schedule. Take your medications as prescribed. If your blood sugar is high, you may be tempted to take too much insulin or an extra pill. However, doing this is dangerous and could lead to hypoglycemia. If you are taking insulin or a medication that is known to cause low blood sugar, you should check your blood sugar regularly. Checking your blood sugar regularly and before and after vigorous exercise can help you catch a low before it becomes an emergency. How do you treat hypoglycemia? If your blood sugar is between 59 and 70, eating 15 grams of fast-acting carbohydrates can help bring your blood sugar back to normal. If after 15 minutes it is still below 70, eat another 15 grams of fast-acting carbohydrates. Once your blood sugar is in the normal range, between 80 and 130, eat a small snack to prevent another low. Fast-acting carbohydrates include 1/2 cup or 4 ounces of regular soda, not diet, 1/2 cup or 4 ounces of fruit juice, 1 cup or 8 ounces of skim milk. Hard candies. Be sure to check the label to see what serving size equals 15 grams of total carbohydrates. Glucose gel or tabs to be chewed for better absorption. Avoid having anything with chocolate, nuts, or higher fat dairy because fat and protein slow the digestion of the carbohydrates into sugar, so your blood sugar won't rise fast enough. Remember, it can take 15 minutes for the carbohydrates to raise your sugar. Try to stay calm and not overeat. What happens if your blood sugar goes too low and you're asleep or unresponsive? There is an emergency medication called glucagon that can be injected into you if you're unresponsive. Somebody who finds you unresponsive can easily inject glucagon into your body. Glucagon is a hormone that breaks down stored glucose, so glucose can enter your bloodstream and bring your blood sugar up. Your doctor will prescribe you a glucagon injection kit. Keep the expiration date of your kit written down and request a new prescription as that date approaches. Be open about your diabetes with family, partners, friends, and coworkers so they can help you if you need it. It is important that you show them where the kit is and how to use it. Wear a bracelet or necklace that says that you have diabetes. Keep a card in your wallet that says that you have diabetes and lists your medications. Set up an emergency alert on your cell phone to let people know that you have diabetes. To see a demo of how to do a glucagon injection, please go to www.bmc.org/glucagon. For the most part, hypoglycemia is preventable and almost always treatable. Stay prepared, keep your meter and glucose source with you, and if you feel odd, check your sugar. Sometimes low blood sugar and high blood sugar can feel similar, so it is important to be sure you are low before treating. If you eat because you feel low but your sugar is actually high, your blood sugar will rise even higher, making you feel worse. For more information, talk with your doctor, dietitian, nurse, pharmacist, and diabetes educator. They are all here to help keep you safe.
Hyperglycemia is the name given for high blood glucose levels. Diabetes UK lists a value of over 8 millimoles per litre taken at least 2 hours after the last meal as being higher than normal. The Mayo Clinic notes that the signs of high blood sugar may not appear until blood sugar levels rise above 11 millimoles per litre. Signs that your blood sugar is high can include feeling thirsty, needing to urinate often, feeling tired and lethargic, feeling hungry despite having eaten recently, not being able to think as clearly as usual. If blood glucose levels rise without being adequately treated, the following symptoms may develop: fruity smelling breath, if ketone levels rise as well, nausea, coma. There are a range of factors that can bring on high blood sugar levels. The American Diabetes Association lists the following reasons: insufficient diabetes medication to cope with carbohydrate intake, not taking part in exercise that had been planned, suffering from illness or an infection, going through stress. Non-strenuous activity, such as walking, can help to decrease blood sugar levels. People taking insulin may need to increase their insulin dose. Adjustments to insulin should only be done with your health team's approval. If you're unsure, contact them first. If you frequently get high blood sugar levels, arrange to discuss with your doctor how to manage your blood glucose.
It will be handy to have your own hypo kit if your blood sugars are too low, and when you are using an insulin dose as way of managing high blood sugars, readings above 10, when you do so without a meal. Remember, when using your kit for low blood sugars, to take some form of carbohydrate as well.